with how do your medical referral sources think? And this is really the key to success here because they were trained in disease processes and deficits. They see limitations and support or lack thereof, and they only know home care based on their experience. Meaning, I had one paragraph in one book during the 4 years that I was in college to become an occupational therapist that talked about Medicare certified home health. That's it. And most clinicians believe that they know what home care is. The problem with that is they don't. I think we all believe that medical referral sources could benefit from understanding the breadth and the depth of your service line. So they believe that all home care agencies are the same. So why should they meet with one more sales rep? And your job is to not only differentiate, but also to give them really good, valid business reasons for seeing you. Let's talk about medical referral sources. So one of my big success points was that I am able to get medical referral sources to listen to me about in-home non-medical care. And the reason that I believe I've been so successful over the years is by speaking to them in their language, which is by diagnosis. So who is a medical referral source? Well, this whole list here would definitely have medical referral sources in them that could give you a client or patient. So here are just a few tips to remember when speaking with a clinician, a doctor, a nurse, a social worker, an MA. Remember, they're their patients, not necessarily your patients yet or clients. Your job is to paint a picture of that potential referral source on how they move or how they behave. That's why diagnoses are so powerful. Success stories. How have you cared for other clients or patients who've had CHF, congestive heart failure, or COPD, or pick a diagnosis? Help them implement their treatment plan. They only get to see this patient for maybe 15 minutes at a doctor's office visit, or maybe just an hour a day in the clinic. How can you help them implement their treatment plan at home? And clinicians are great teachers. Ask if you don't know. You know, I was working with a sales rep a number of years ago, and she came out of a sales call and she said to me, "What is cabbage? And why would we treat cabbage? Isn't that a vegetable?" Well, of course not. It was just an acronym for a cardiac procedure, but she didn't know, and that's okay. That's what Google is for, and that is absolutely what your clinicians are for. And so if you don't know, just ask them. Say, "I'm unfamiliar with that acronym. Can you please share with me?" Sure, most clinicians will be more than happy to share with you the information. And what is the major benefits of referring to home care? Well, of course, we manage the disease process at home. We can reduce the need for urgent visits. Through compensation techniques, we reduce the risk of falls. Earlier intervention due to signs and symptom management. There's so much that we can do to help these patients. Let's continue. Improved outcomes all over the place. We know that home care and Medicare certified home health can really be an amazing benefit to the patient, client, and the referral source.